Lower back pain affects millions of people worldwide, and if you're watching this, chances are you or someone you know has experienced it. But here's what's frustrating. Many people leave their doctor's office still confused about why their pain keeps coming back. The truth is, lower back pain is complex. It's rarely just one thing going wrong. Today, we'll walk through 5 common causes that often get overlooked or poorly explained, and we'll back everything up with real research. By the end, you'll have a clearer picture of what might be driving your pain. Why lower back pain is hard to diagnose. Before we dive into the specific causes, let's talk about why diagnosing lower back pain is so challenging. According to clinical practice guidelines from the American Physical Therapy Association, low back pain often does not have a single, identifiable structural cause. In fact, in approximately 90% of cases, the exact generator of pain cannot be identified with certainty. What we do know is that mobility deficits, psychosocial factors, and pain mechanisms all play a role. Physical findings on examination often fail to fully explain why someone is experiencing symptoms. This is why factors like fear-avoidant behavior and movement patterns have become important considerations in understanding chronic back pain. This doesn't mean your pain isn't real. It means the picture is more complex than a simple structural problem. And understanding that complexity is the first step toward effective treatment. Cause number 5, loss of hip and lumbopelvic mobility. Let's start with something that often gets missed: hip mobility. Your hips and lower back work together as a coordinated system. When your hip joints become stiff, particularly in rotation, your lumbar spine has to compensate. This altered movement pattern increases strain on the lower back structures, which can lead to pain over time. Research has shown that reduced hip motion is associated with altered lumbopelvic movement in people with low back pain. One study found that individuals with low back pain demonstrate altered trunk and hip kinematics, suggesting coordination deficits between the hip and spine. Think of it this way: if your hips can't move the way they should, your lower back has to pick up the slack. Over time, that extra work becomes a problem. This is why assessing hip mobility, especially hip rotation, should be part of any thorough evaluation for chronic low back pain. Limited hip internal rotation, in particular, often correlates with increased lumbar stress during everyday movements, like walking, sitting, and standing. Cause number 4, poor core stability and control. When most people hear core strength, they think of six-pack abs. But core stability is about much more than surface muscles. The deep stabilizers, muscles like the transversus abdominis and the multifidus, are responsible for controlling the position of your lumbar spine during movement. When these muscles aren't working properly, your spine loses its ability to maintain a stable, neutral position under load. This lack of control leads to compensatory movement patterns and pain. A randomized controlled trial, published in 2020, examined the effects of core stability exercises combined with hip muscle stretching. The results were significant. Patients who performed core stability and hip muscle stretching exercises showed meaningful improvements in pain intensity, disability level, and quality of life compared to the control group. What's important here is that core stability isn't about doing hundreds of crunches. It's about retraining the deep muscles that control spinal positioning and load transfer through the pelvis and spine. If you're tired of one-size-fits-all explanations and want a more personalized evaluation of what's actually driving your pain, consider a detailed assessment from a spine specialist. Cause number 3, facet joint degeneration and misalignment. Now let's talk about the facet joints, the small joints on the back of your spine that help guide and stabilize movement. Facet joints are synovial joints, similar to the joints in your knees or hips. They have cartilage, joint fluid, and a capsule. Their orientation, the angle at which they sit, plays a crucial role in how load is distributed through your spine. When there's asymmetry between the left and right facet joints, a condition called facet tropism, it can change how forces are transmitted through that spinal segment. This asymmetry can lead to uneven loading, which over time may contribute to degeneration and pain. A 2020 study examined facet joint parameters in over 500 patients. The researchers found that facet tropism, at all 3 lower lumbar levels, was significantly associated with the incidence of chronic low back pain. When the facet joints are asymmetric, the spine tends to rotate toward the more oblique joint when loaded. This creates additional torsional stress on the intervertebral discs, which can accelerate degeneration. This is something that can be assessed through imaging, but it's often overlooked in routine evaluations. Because number 2, nervous system sensitization. Here's where things get particularly interesting. Chronic pain can actually change how your nervous system processes pain signals. This phenomenon is called central sensitization. When pain persists over time, the nervous system can become hypersensitive. The volume gets turned up, so to speak. This means that even minor inputs, things that wouldn't normally cause pain, can trigger significant discomfort. Understanding which mechanism is driving someone's pain helps clinicians tailor treatment more effectively. Someone with minimal structural changes might experience severe pain due to central sensitization, while someone with significant degeneration might have minimal symptoms. This doesn't mean the pain is all in your head. Central sensitization is a real physiological process, involving changes in how the spinal cord and brain process sensory information. It's a protective mechanism that has gone into overdrive. Because number 1, fear, guarding, and movement avoidance. And now, the number 1 cause that often doesn't get explained clearly: fear-avoidant behavior. When you experience pain, it's natural to become cautious. You start moving differently to protect the painful area. You avoid certain activities. You tense up. This is a normal, protective response. But here's the problem. This protective stiffness and altered movement pattern can actually perpetuate the pain cycle. When you move with excessive guarding, you increase muscular tension and alter the normal biomechanics of your spine. This paradoxically increases load on the very structures you're trying to protect. Going back to the clinical practice guidelines, the research states that there is evidence that fear-avoidant behavior may contribute to persistent pain and reduced function. This creates a vicious cycle. Pain leads to fear. Fear leads to avoidance and guarding. Guarding leads to altered movement patterns, and this ultimately leads to more pain. Breaking this cycle requires a shift in mindset. Movement, when properly guided, is often therapeutic rather than harmful. What this means for you. Bring this all together. Lower back pain is rarely just one thing. What we've discussed today: hip mobility, core control, facet joint asymmetry, nervous system sensitization, and fear-avoidant behavior. These factors often interact and overlap. Understanding the mechanisms behind your pain is empowering. It shifts the focus from passive treatments to active strategies that address the root causes. The key is getting a thorough evaluation that looks beyond just imaging findings and considers all these potential contributors. If you want a second opinion on why your back pain keeps coming back, not just another round of generic advice, our clinicians can help you make sense of your symptoms based on your movement history, imaging, and functional findings.